Okay, Jonah, patient assessment trauma. You have 10 minutes to complete.
Okay.
Do you have any questions before we begin?
I do not.
All right. You are dispatched to I-90 at 30 westbound for a motor vehicle rollover crash.
Okay. BSI, is my scene safe?
It is safe.
Do I have any additional information on patients?
This is your only patient, only one occupant. Laws on scene. Fire is currently extricating him.
Okay. This is my only patient. I'm going to call in additional resources as needed. I do not know my mechanism of injury at this time other than it's just a vehicle accident.
Vehicle rollover.
Vehicle rollover. Okay. I'm going to take that into consideration and always have C-spine precautions. And just due to this being a rollover accident, that does meet my C-spine criteria. So I'm going to have this patient in a C-collar once the chance arrives.
Okay, so fire has extricated him. He's currently backboarded.
Okay. Perfect.
They say that he was complaining of pain in his lower legs and that he was not wearing a seatbelt. Or he was wearing a seatbelt, but they noticed starring on the windshield.
Okay. My general impression on my patient right now, just due to the mechanism of injury, is going to be poor. Are there any life threats that I see at this time?
No major bleeding at this time.
Okay. My chief complaint also is my lower leg pain. Just because of the star in the windshield, I'm going to take into consideration that C-spine and possible head injury as well for this patient. When I try to get responsiveness from this patient, what do I get?
He's alert.
Okay. LOC is good. ANO times 4?
He is 3 out of 4.
3 out of 4? Okay.
He doesn't remember events.
Okay. And GCS of
14.
14? Okay. I'm going to go right into my airway, breathing, and circulation for this patient as well. My airway, is it patent?
Yep.
Clear?
He's
Okay.
able to control it.
Okay. My breathing, what's my rate, rhythm, quality?
20-minute bilateral chest rise and fall. Quality is good.
Okay. I'm also going to take into consideration oxygen therapy if needed. Same thing with ventilatory assistance if I need to as well. I'd use oral or nasal adjuncts.
Okay.
I'm going to move into my pulse as well. What's my
Rapid and regular.
rapid, regular? Okay. Skin signs?
Pink, warm, or dry.
Pink, warm, and dry? Perfect. Just due to my patient's GCS and then just the mechanism of injury, I'm going to get this patient loaded. I'm just going to go to the hospital for sure. I'm going to also have my partner start immediate vital signs on this patient, 2 large bore IVs either side. I'm going to move into my secondary assessment for this patient as well. I'm going to check his skull. DCAT BTLS, do I see anything?
He's got a large hematoma on the right side of his forehead.
Okay, noted. What about my pupils? What do I see for my pupils?
One is blown, and
Okay.
the other one's reactive.
All right. Is my C collar still holding good to this patient? Okay. I'm going to check ears for haloing. Any DCAT BTLS?
In his ears, no. Cheeks are clear. He does have a black eye.
Okay. What about my nose? Any
Nose is
secretions? Clear. Airway?
Still clear.
Still clear. I'm going to check his C-spine as well. Step offs, DCAT BTLS.
Clear.
JVD, tracheal deviation for his neck.
Clear.
Okay. Still good pulses there as well.
Yes.
All right. Checking his chest, any flail segments.
Just stable bilateral chest rise and fall.
Okay. No DCAT BTLS. Checking his abdomen as well, palpating all regions, quadrants.
Clear.
Clear. I'm going to check his pelvis too. Crepitus.
Stable.
Stable. Same thing for his legs, for his upper legs. Anything?
Upper legs are clear on the right.
Okay. Femoral pulses.
Femoral pulses are present.
Okay. Moving down to his lower extremities. Do I feel anything for his lower extremities?
Sorry, both upper legs are clear.
Okay.
Both lower legs, you notice obvious deformity.
Okay. Bilaterally.
Yep.
Perfect. CMS.
Intact.
Intact. I'm going to also assign a couple of my partners to start splitting those.
Okay.
Making sure they check CMS before and after splitting those. I'm going to go ahead and check his arms. Do I have CMS, distal pulses, DCAT, BTLS, anything?
You have distal pulses. They are clear.
Clear? Okay. I'm also going to check the back of my patient as well, spine, decap BTLS all the way down to the feet. Anything?
Clear.
Clear? Okay. I'm going to get this patient loaded up into the ambulance, ready to go. Those IVs have been done. Make sure that I'm stabilizing, keeping the neck stabilized, making sure that both of those lower extremities have been splinted appropriately and that CMS is still intact. Reassessing all these treatments every 5 minutes. Same thing with my vitals every 5 minutes.
Okay. He's complaining of some pain
Okay.
in his lower legs.
In his lower legs? Okay. Taking into consideration his respiratory drive as well, I'm going to choose to use fentanyl.
Okay.
And I'm going to do 1 microgram per kilogram.
Anything else you'd like to add?
Not at this time.
All right. Good job.